Supposed to be the kinder, gentler health care plan. As expected, Senate Republicans released a new discussion draft today designed to replace the Affordable Care Act. Health anchor Liz Bonus joins us now with some of what's in it. Liz.
Hey Paula, good afternoon once again. They are calling this the new discussion draft of the Better Care Reconciliation Act. That's a mouthful, huh? It is similar to the House bill passed last month, but there are a few changes getting a lot of attention today. Now, one of those had protesters camped out at Mitch McConnell's office on Capitol Hill, many of them not wanting the suggested changes to Medicaid. This new draft cuts Medicaid spending from the Affordable Care Act, but at a slower pace than the House suggested. The current program would not end that until 2024. A few other notes, according to Medpage Today, the new bill does not change coverage for certain what they call essential health benefits by insurance companies. It does, however, eliminate that requirement for Medicaid plans beginning in 2020. The subsidies to help pay for health care would still be based on income, but older adults will pay more than those who are younger. And this draft also includes money directed for states to decide how to use each year. I asked local health care administrators about this money and how they feel about some of these proposed changes overall.
I think that's got a lot of value and a lot of merit because a state like Kentucky, a state like Alabama is much different from a state like California, New York, or Florida. They have different needs, different constituencies, different ways that they might deploy that money. Same with the local healthcare rules.
We have worked so hard to improve our quality, to address the issues of diabetes and other chronic diseases, but to help educate patients. And the oral health programs that have been developed, the behavioral health programs that we have begun to integrate in the primary health care space is going to be dramatically impacted.
This Senate bill, as did the House bill, eliminates funding for Planned Parenthood and prohibits giving money to insurance plans to pay for abortions. It also allows states to impose a work requirement on those who receive Medicaid. A lot of that was already in the House bill. The kinder, gentler things were mainly about some of the timelines and a little bit more about what would go to the states. We're probably going to be discussing this for a little while.
I was going to say.
Even if the Senate gets the vote that they want by July 4th, it still has to go to another committee then.
Yeah.
And they would combine the House and the Senate bill. So we're going to be sorting out some details and having these discussions like we've probably been having since about 2010.
And everyone's going to be going online and go, what does it mean for me? In my age group, my bracket, the
well, and that's right. It isn't one thing for all or one thing for all people, all incomes, all ages. And, you know, sort of that's some of what some say needs to be done because you use healthcare differently. Other people say, you know, we all need to contribute so that everybody gets something evenly. We'll see where it ends up, and we will, of course, continue to sort it out.
All right. Thank you, Liz.